people mad here, but I've got to say this. I'm a physician and I take care of menopausal women, and I have women come to my office who've been treated by other healthcare providers for hormone therapy and are getting injectables or pellet therapy, and they are being overdosed. This is a woman whose pellets were supposed to have worn off by now with still a testosterone level of 270.
So it is true that a level of 270 testosterone for a female, that's elevated. That's certainly above reference range, but we can't directly attribute that to pellets. That's less likely a product of pellets and more likely a product of improper dosing for that particular patient. You can overdose on anything. You can overdose on gel, on cream, or injections, and on pellets. And it's also important to understand when you get tested after you get your pellets placed. Pellets dissipate over time. So if you get pellets put in and you get your testosterone checked a month later, it could be way higher than what it is 2, 3, 4, 5, even 6 months down the line. So it's important to put that into context.
For a woman at her peak, 2 to 45, no more than 70. After 90, we start looking for a tumor.
Looking for a tumor where? Is she doing bone scans? Is she doing CT scans? Is she doing full body MRIs? Where is she looking for a tumor at? And anyway, ladies between the age of 40 and 45 should be getting breast cancer screens as just a rule of thumb. And I'm pretty sure a physician who prescribes testosterone to a patient and the results come back with a testosterone level of 90, they're not looking for a tumor.
This is not the 10th time I've seen this. Y'all are being overdosed with testosterone. 5, 6, 10 times more than you ever would have reproduced in your normal reproductive life. We are not little men. That is a man's level. Unless you are transitioning from female to male, I cannot think of a reason for you to have a testosterone level that high.
Yeah, so she's just using a bunch of trigger words at the end there. So overall, it's important to understand that if you're prescribed testosterone and your levels are 5, 6, 7 times above the reference range, it's important to communicate any symptoms or side effects you're having with your doctor. And it's probably more important to understand that it's less likely a byproduct of the delivery system and more likely a product of the dosing. Because again, you can overdose on anything, a cream, a pellet, a patch, a gel. That's not the issue. More likely the issue is the amount of hormone that you're getting rather than how you're getting it. So the grade for this video: for fear-mongering and sensationalism, A+. For transparency, information, D-.